Jackson Hospital from Cancer Screening and the Tumor Board Director, Donna Long. Welcome to the show.
Thank you.
Nice to see you. You're RN and you're the Tumor Board Director. That sounds like you have a lot of power over there.
No, I don't know about that, but yes, I'm responsible for all the cancer screenings, and then our tumor boards, I help coordinate those with our physician leaders. If you get a diagnosis of cancer, all the physician experts come together and they talk about your individual case and come up with your individual care plan for you.
And that's good to know, I think, that you've got a team really of experts that are making suggestions and decisions, helping you make decisions about your care and treatment. And cancer screening, I mean, we all know people with cancer, we all know maybe we ourselves have had it. It's just very, very common. And that's why cancer screening is very important. What is cancer screening?
So cancer screening is looking for disease when you don't have any signs or symptoms, because you want to catch it early when it's most treatable and you'll have the best outcome. You know, a lot of times if you wait till you have signs or symptoms, then you go see your doctor and they look for something. Many times it's advanced stage diagnosis, which is harder to treat, and maybe your outcome isn't going to be as good, your survival. So we encourage people to get screened, look for it. If you have a negative screening, what a peace of mind you have that I'm healthy, and if you have something, catch it early and treat it.
It'd be nice if you could go into a thing like at the airport and get screened and then be able to tell you everything about your body, but maybe someday.
Someday.
But right now.
You know, there are some advances. We have at Henry Ford, we offer this blood test, which is a multi-cancer early detection test. Because we have 5 cancer screenings. We have breast, cervical, colon, lung, and prostate. But what about all those other cancers? What about your pancreas or your liver, you know, brain, things like that, that we don't have screenings for? You kind of got to wait till you have signs or symptoms. So this blood test is available that can detect up to 50 different cancers.
Oh, no kidding.
So detect it sometimes up to 9 months earlier than you'd find it on a regular screening, scan, imaging, things like that. So yeah, we've offered that for almost 4 years now at Henry Ford. So some of the insurances are starting to get on board and cover that test, because obviously the quality of life you can have, plus the cost savings if you catch it early versus late. So, are
all the screenings besides the blood test available at Henry Ford?
They are.
Okay.
Yep.
So some people, they don't want to know because they're afraid of the results. And I know people that think, well, if they cut into me, then the cancer is going to suddenly multiply. You know, people have some probably fearful thoughts about cancer, and that's why they don't get screened. What do you say to those people?
You know, that's a reality, is the fear. I don't want to know. I've heard people say that to me. But actually you do want to know, for reasons that I've said many times, is you want to catch it early, and depending on where it's located, if it's not spread, it's all encapsulated, you can have a surgical procedure and it's gone. Lung cancer is a perfect example of that. You may not need radiation or chemotherapy if it's all contained. It depends. Each cancer is different. But what if, like I said, you had a negative screen? You'd have a peace of mind.
What are the causes? There's things you can do, and I guess some cancers are going to happen no matter what you do. But what are the things we can do to help prevent cancer?
Well, lifestyle is the biggest thing. Healthy diet, be active as you can. Try to avoid tobacco, smoking, even vaping. Vaping's bad.
What about the Zyn, the tobacco pouches?
Yeah, those cause some, they have carcinogens in them too. Anything you're going to put in your body is going to potentially cause cancer. But the risk factors that you can control, like you said, your healthy weight, your activity, avoiding smoking and heavy alcohol use. But things like your age, when you're 50, just that alone increases your risk by 13 times.
Oh my gosh.
It's like, wow, I did not realize that until I learned that statistic a few years ago. But family history is really important too. You can't change your genes. So yeah, stuff like that. But what you can control, you need to try to control.
So those are putting people at a higher risk. And those are very, like lung cancer, You mentioned heavy drinking. That can cause
Yes, yes. Heavy drinking. A lot of the guidelines will look at 3 or more drinks a day for women, 4 or more for men per day. Over time can increase your risk of certain cancers, certainly liver, pancreas, but also your stomach, esophagus.
I understand there's been an increase in early onset cancer, and I think about James Vanderbeek, who died last week from a cancer, a young guy.
Yeah.
What's causing the increases in early onset cancer?
Well, a lot of thoughts on that number one, it is our lifestyle. We're not as active as we used to be. We all have our electronics and our phone and our diet when we're eating a lot of processed foods. And then also, we're screening and we're catching it early because people are encouraged to go and get screened earlier. So, colorectal cancer a few years ago was 50. Now they've changed it to 45 the past few years just because we know we're seeing it in younger population.
So there is, I guess that younger age for that particular cancer, and then is there like a maximum age where, well, like the colonoscopy, the last one I had, the guy said, okay, well, we'll see maybe we'll never see you again. It's like you get to a certain point where what is it? The cancer is just not advancing fast enough?
Well, a lot of it is your quality of life at that age, and if you have other comorbidities as well. It's an individual basis. Some guidelines will say stop screening at 75 or 80. But if you're an active, young 80-year-old and you would want treatment,
do you think I'm 80?
I'd be getting screened. No, not you personally. No, just in general.
No, I know you don't think I'm 80. We're talking about our ages before the show.
Yes.
Yeah. All right, so March is colorectal cancer screening month, right?
Yes, colorectal cancer awareness month.
Okay, so what is colorectal cancer?
So obviously cancer in your colon, when your colon's like 30, 40 feet long, or the rectal area, and it's the 3rd most common cancer, but it's the 2nd leading death from cancers.
It is?
Mm-hmm. You know what number 1 is?
Why?
Why?
Do we know?
Oh, colon, probably because it's caught later in more advanced stages. It's a really aggressive cancer too.
That might have been James Vanderbeek's.
It might have been. We try to catch it early, but it's nobody's favorite screening. Nobody wants to talk about it.
Right?
Colonoscopy. There's other methods too, depending on your risk factors. If you're average risk, meaning you've never had polyps, you don't have polyps in your family, you haven't had a direct relative with colon cancer, you can do, there's FIT tests that look for blood in the stool, which could be a sign, or Cologuard. You see the fancy dancing blue boxes on TV advertisements.
Yeah. What do you think about the Cologuard?
So they're both acceptable tests for the average risk people. So, it depends on what's right for you. Personally, the gold standard has always been colonoscopy because if you have polyps, they can remove them right there during the procedure and take them out before they become cancer. If you have a positive Cologuard or a positive FIT test, you're going to need a diagnostic colonoscopy anyways. So if you can, and then if you have a negative clean colonoscopy, you're usually good for 10 years.
Might as well do it.
Might as well.
All right, so you've got at Henry Ford several outreach events, including, I understand, the inflatable colon.
Yes.
What's that?
Several, 11 different locations throughout the whole system. Some of them that have the space to accommodate it. We have a large colon. It's like 12 feet by 12 feet, 10 feet long. And you can walk through it and it'll show you what polyps look like on the inside of the wall. Or you've heard of diverticulosis, the little like ulcerations inside the colon that can become infected and cause people issues, or Crohn's disease. And then, of course, we have little depictions of the colon cancer itself and what it looks like, and then what normal tissue looks like. So that visual is so impactful, and when people come in, we'll see that. And I've had somebody come to me, we had it in the Jackson Hospital once, what we call the tabletop model, just because of size, but that's still on an 8-foot table. It's pretty big. He just walked up to me and said, "This works." I said, "What?" He said, "This right here." He goes, "I came and talked to you last year, and you talked me into this, and I went and got screened, and I'm so glad I did."
Oh, wow.
And that was just really impactful to me, that I'm making a difference, that I might have saved somebody's life.
I'm sure you have. I mean, that's awesome. So are there some symptoms, maybe you don't have the test scheduled, or there's some things maybe people would be worried about that would indicate you might have colon cancer?
Sure. So symptoms you'd want to look for is change in your bowel habits, either constipation or diarrhea, and any rectal bleeding or abdominal pain. You definitely want to talk to your doctor, because in those situations they'd probably send you for a diagnostic test, a diagnostic colonoscopy.
And like smoking with the lungs, are there some risk factors maybe, or things that we can change to reduce chances for colorectal cancer?
Yep. Again, you can't say it enough. Your diet, eat a diet that's high in fiber, those green leafy fruits and vegetables, drink a lot of water, try to avoid processed food. There you go.
Yeah, you remind me.
Processed food, stay as active as you can.
What's a polyp?
A polyp.
Polyp.
A polyp is an abnormal growth in your colon. They can be really, really tiny, like the size of a pea, or they could be, golf ball size too. It just depends. And
golf ball size?
So they've had some that are that size. Those are usually a problem.
I would
So
think.
if it's that size, it's a problem. But yeah, it depends. They're masses of all different size, but usually they're very tiny that they can detect and remove in colonoscopy before they become cancer. So they are precancerous growths.
So March would be a good time to get screened.
Absolutely. Okay. Yeah, and patients can self-refer now for colonoscopy. They can call our GI office and ask to get their colonoscopy scheduled. You can go on MyChart if you're a Henry Ford patient and you have your MyChart set up, and you can schedule appointments or request screening appointments. Same thing for mammograms. Women can self-schedule their mammograms, so you can pick the location, date, time that's convenient for you. Go online and do it.
All right, get screened.
Exactly.
Yes.
The only bad decision is not getting screened.
There you go. Check it out. More information available, of course, at Henry Ford Health, and more on Wellness Wednesday online at jtv.tv and at Henry Ford. Thanks so much, Donna, for coming in today.
You're welcome. It's my pleasure. Thanks for having us.
RN Donna Long from Henry Ford Jackson Hospital on today's Wellness Wednesday, presented by Henry Ford Health.